Good afternoon. First of all, I want to apologize because I'm not present. I have problems with my flight to return to my country. I'd like to stay with you, but it is impossible. My speech is about the technique of reconstructive relational experience and resilience in the disruptive situations. A human being constitutes itself and develops as a result of the integration and interaction of the interfaces of its biological, psychological, and relational aspects. The central psychodynamic axis supports the claim that a disorder is a result of the bond and is also expressed in the bond. No psychic pain is disconnected from human relationships, and the disorder acquires meaning in its expression and communication in the relational world. Psychic pain has its origin in the form of the primitive object relations and of bonds that the individual has created in fantasies or in the reality. It's recurrent due to the homeostasis obtained in the compulsive repetition with objects that reaffirm the expectation of its pattern bonding matrix. We understand that only by altering the sick bonding pattern of the subject we can change their behavior. The purpose is to find in reality the repetition, evidence, and crystallization of that sick primitive pattern. This positions us among those who believe that some genetic potentials may become a reality or not, according to the relational experiences lived in these meaningful relationships. These relational experiences may alter or create new synaptic paths in the human mind by confirming or altering the potentiality inscribed in a particular gene. The reconstructive relational experience technique is based on this form of relationship to give it a new meaning. It is a technique based on the relational concept of the bond, and it is critical when applied in support intervention in the occurrence of disruptive events. It is at this point that we process the development of resilience and psychological immunity. In order to present this topic, I will address 1. Resilience and the disruptives. 2. What does disruptive mean? 3. Reconstructive relational experience. And 4. Development of resilience in interventions. 1. Resilience and the disruptive. Resilience is a term used to define the human capacity to undergo successive adverse experiences without impairing the development. In psychology, it's the human capacity to overcome adverse or disruptive situations, example, loss, stress, crisis, with minimum dysfunctionality in the behavior, adapting or adjusting to the new situation. Resilience is a psychological phenomenon that is developed, and it is not a trait that people acquire by themselves. Resilient people have the support of people that are important to them. They have established bonds, whether for support or in a search for role models. These people act as co-metabolizers in the psychic processing of resilience by transforming feelings of mourning and loss into hope by rescuing their self-esteem and self-confidence. Resilient people have built a resilient ego in the course of their development. This psychological condition has to do with individual potential. Therefore, the processing of the resilience is based on the relational. Resilience has an ethical dimension because it is only possible to develop it when there is a hope in the future and a meaning, a goal, and an ethical horizon. Therefore, the promotion of resilience serves not only individuals going through difficulties, but the whole community committed to these people. Social and cultural factors and community participation help to understand, listen, and offer support in face of a destabilizing setting. It is from transdisciplinary groups that gather around common goals that it becomes possible to perform tasks that enable the improvement of the quality of life of all those involved in relation to these disruptive events. Topic 2. What does disruption mean? The disruptive concept proposed by Beniakar in 2002 makes it possible to differentiate what goes on outside of what goes on in the mind or in the psyche. Not every event is destabilizing or traumatic to the psyche, and when it is, it will not be the same for all individuals it harms. We differentiate the phatic universe from the psychic universe, each of which has its own specificities. Individuals and or communities healthy, plagued by such disruptive violence, face a type of emotional stress which may be evolved into a potentiality traumatic disturb and may present psychic maladjustment and illness. It establishes the non-existence of the traumatic situation, but potentially traumatogenic situation. The trauma may be occurs only in the psyche. The phatic universe is related to the external or the surrounding of the psyche and has its own dynamic process. These situations establish emotional experiences and experiences generated from real facts, provoking in the most of the cases threatening perceptions of reality. So the society is exposed to all great human fears simultaneously. These feelings, when lived, are felt through the sensations that are present in our psychic primitivism. Therefore, they are not verbal. Studies and researches have been conducted since the second half of the 20th century in order to diagnose symptoms, illness patterns, and to develop interventions, actions in this new field. So, we need for disruptive situation assistance intervention. This assistance intervention is based on the encounter of psychics, that is, in a relation of intersubjectivities. We propose assistance intervention to consider human subjectivity as a starting point. We need a contemporary model for assistance and treatment in this disruption time, including human factors or, again, the human subjectivity. They should be directed to the communities hit by the disruptive, meeting their specific needs and characteristics. 3. Reconstructive relational experience. The reconstructive relational experience, or RRE, is a methodological tool as a way of including human factors in the intervention as well as the capabilities of the resilience of the subject. The approach of RRXE presents the central value of the intervention, its reconstructive effect on the subject, and the multiplier effect in the community. The reconstructive relational experience is applied in an intervention as an experiential intervention in crisis, which creates a transitory space with transitional qualities for containment and sustainability. The use of the word reconstructive is specific. I am not correcting but looking for new meanings by attempting to articulate affection and representation of the disruptive event nowadays. This can only happen in an intervention that promotes the psychic processing of the imbalance that the anguish provoked. This will only occur within a relationship involving positive affection or affective to process the feelings of helplessness and impotence that the disruptive generated. The RRE used in an assistance intervention will lead to a resignification of the conflict. The model of intervention is created according to each individual or population's specific needs and, at the same time, with the need of systematizing the assistance to this healthy population damaged by the confrontation of a disruptive event. It is your commitment to the clinician. The clinical function in the assistance interventions is what we are looking for. It allows considering the impact of the disruptive as an opportunity of change for the strengthening of the psychic immunity and resilience, for development of resilience in interventions. The general objectives applied to interventions due to disruptive situations are: impact of RRE on individual defense mechanisms that make it difficult to metabolize a disruptive event. Describe the reorganization of group dimensions that favor the development of psychological immunity and resilience. Activate ways of elaboration through group relational experiences. Promote individual positive change, here depending on the management of the impotence or omnipotence axis. Increase resilience capacity of people. But what is the way in which the RRE activates the reorganization in the micro-universe and the macro-universe for processing the resilience? Through changes in the defensive expressions of omnipotence and impotence through interrelationships. Development of the phenomena belonging to such axes. It promotes the development of resilient manifestations of the subject through the psychological immunity by encouraging the confrontation of the situation experienced. These experiences will promote a double access route to the damaged. One is clearly individual. The other is through the impact in the group ability pertaining to the process in which it participates and its repercussion at the community level. Thank you very much.